You find yourself lying awake at night, replaying moments in your mind that make your heart race. Perhaps you avoid certain places or conversations because just the thought of them sends a chill down your spine. Well, I'm sorry to say this, but you might be carrying the weight of trauma, even if you don't always recognize it. These are 9 signs that indicate you have suffered trauma. Trauma isn't always a single dramatic event like it's mostly shown to us. It can be a series of smaller, distressing experiences. Whether it's a workplace incident that left you shaken, a painful breakup that shattered your confidence, or a childhood memory you've tucked away. The mind and body work together to protect you, often storing painful events deep inside. Over time, these experiences influence your feelings, actions, and connections. If you recognize any of these signs and they're affecting your daily life or relationships, consider reaching out to a mental health professional. Remember, you don't have to walk this path alone. Sign number 1, hypervigilance. Hypervigilance is like your internal alarm set too high. You might find yourself startled by small noises like a slamming door or a car honk, and your senses feel on edge. While alertness can help in danger, living this way is exhausting. It's as if your body never relaxes and is always ready to jump, react, and subconsciously stress you out. If your heart races when someone drops a plate, or if you avoid busy places because you feel exposed, these could be signs of hypervigilance. You might notice your muscles tense or have trouble concentrating because your mind keeps scanning for threats. Simple calming techniques like progressive muscle relaxation or mindful breathing can gradually lower your internal alarm, slowly but surely putting your mind at ease. Sign number 2, emotional numbing. Have you noticed yourself being unable to truly cry, laugh, or feel joy in things you once loved? This could be emotional numbing. It's like wearing a mask. Your face goes through the motions, but inside you feel hollow. This isn't about weakness. It's your mind's way of shielding you from overwhelming pain. When someone asks how you're doing and you respond, "I'm fine," without knowing what fine means, that's numbing. Loved ones might say you seem distant or not yourself, but you're not sure how to explain this emptiness inside. So you just pull the classic, "they wouldn't understand," and continue as it is. Honestly, writing about your feelings, something like journaling, can help you slowly rediscover your emotional palette, one feeling at a time. Sign number 3, intrusive memories and flashbacks. Have you ever been blindsided by a vivid memory of a painful moment, complete with sounds, smells, and emotions? Intrusive memories and flashbacks can strike from seemingly anywhere. During your commute, while working, or even when you're trying to unwind. You might flinch, your breathing catches, and suddenly you're reliving that moment as if it's happening right now. Stressful, right? These flashbacks aren't intentional. They reveal that your brain hasn't fully processed the trauma. Until these memories find a place in your mind's filing system, they burst out uninvited. Something that might help in moments like these is grounding exercises. So for more context, naming 5 things you can see, 4 things you can touch, and 3 things you can smell right now. That helps anchor you in the present, bringing you back to the moment of your life that hasn't passed and can be changed, rather than the one that your brain is struggling to process. Sign number 4, avoidance behaviors. As with most of these signs, avoidance behaviors arise when your mind wants to protect you. You sidestep anything that might trigger painful memories. If you were in a car accident, you might refuse to drive or ride as a passenger. If you survived an emotionally abusive relationship, even mentioning that person's name might make you leave the room. Avoidance offers relief in the short term, but it makes recovery harder in the long term, since you're allowing fear and anxiety to to grow. Gradual exposure, confronting triggers in small, safe steps, often guided by a therapist, can help you reclaim parts of your life you've locked away. For example, if driving terrifies you, a short ride in a familiar area can rebuild confidence. Sign number 5, sleep disturbances. Trauma can hijack your sleep. Nightmares, insomnia, or waking up drenched in sweat. Night after night, your mind tries to process what happened, and if it hasn't, sleep becomes a battleground. You might dread bedtime, fearing panic-inducing nightmares. Others slip into oversleep as a way to avoid the day. Neither extreme is healthy. If your sleep changed significantly after a distressing event, consider talking to a professional. Changes like a consistent bedtime routine, limiting screen time, or practicing relaxation exercises before bed can restore restful sleep. In severe cases, therapy or medication might be necessary to reset your sleep cycle. Sign number 6, physical symptoms without clear cause. When trauma lodges in your body, you feel it everywhere. You might experience headaches, digestive issues, or unexplained pain, but doctors find no medical cause. That's because trauma can keep your fight or flight system activated, flooding your body with stress hormones that tighten muscles and inflame tissues. If tests come back normal, consider whether unresolved emotional wounds could be at play. Practices like yoga, tai chi, or mindful walking help you reconnect with your body and gently release tension. A trauma-informed body worker or a somatic therapy group can offer targeted relief. Remember, healing often requires caring for both mind and body. Sign number 7, emotional triggers and mood swings. An offhand comment, a familiar scent, or a certain time of year can ignite strong feelings, fear, anger, or sadness. When trauma isn't acknowledged, your brain treats these as threats. One moment you're calm, the next tears or rage overwhelm you. These sudden swings can confuse you and strain your relationships. If you find yourself apologizing for overreactions, it's a sign to pay attention. Notice your triggers and use coping strategies, deep breathing, journaling, or talking with someone supportive to regain balance. Therapy can help you understand why these triggers exist and learn to desensitize them over time. Sign number 8, difficulty in relationships. Trauma can build invisible walls between you and those you care about. You might push loved ones away, fearing they'll see your vulnerabilities, or cling too tightly, afraid of abandonment. You discard them momentarily, afraid of losing them indefinitely because of who you really are. Trust becomes a complicated dance. You want connection, but recoil at the thought of being hurt again. If friendships or romances often end with unexpected distance or conflict, past trauma might be influencing you. Therapy can help you unlearn unhealthy patterns and teach you how to trust and communicate more effectively. Stronger relationships can be part of your healing journey, not something to wait for until you feel fixed. Last but certainly not least, maybe even one of the most obvious and most important signs to detect on time, we have sign number 9, self-destructive or risky behaviors. Trauma can lead to self-destructive or risky behaviors like substance abuse, reckless driving, self-harm, or other dangerous acts. These behaviors serve as outlets for unspoken pain, numbing the hurt, punishing yourself, or attempting to regain control. Yet they often become a destructive cycle, creating more problems and distancing you from real healing. Ask yourself, have you been engaging in actions you know are harmful but feel powerless to stop? Recognizing this pattern is vital. It's a cry for help, a signal that your internal world feels chaotic. You deserve support, not judgment. Reach out to friends, support groups, or trauma-informed professionals to discover healthier coping methods. Having some creative outlets, mindfulness practices, or simply sharing your story will always be a step forward as well. Trauma doesn't make you weak. It shows you survived something that tried to break you. If any of these signs resonated, know that you are not alone and that help is within reach. On the contrary, almost every single human being on Earth has, consciously or subconsciously, gone through some type of trauma. What's important to remember is that healing isn't a straight line. Sometimes you feel progress, other times, a setback. Some find solace in therapy, others tap into creative outlets, and some find peace through meditation, exercise, or time in nature. On the other hand, having a healthy community can be a powerful healer as well. If you find this video helpful, please subscribe to our channel for more content like this.